Welcome everybody to part 3 of our question and answers for August. A lot of good comments and questions, so thank you for those who have contributed. And please, if you have questions or comments, please leave them. I will answer everything in this format. Okay, so this is part 3, so hopefully we get them all done with this and we can move on. As I always say, these videos are for educational purposes only. So if you have questions, specific questions, please talk to your provider. Here's my book. The link to that is in the description box below. And without any further blah blah, let's get going. Okay, so where do we leave off? Check Me Out wrote on my Idiopathic Hypersomnia video. He said, help me for KLS. Help. So what is KLS? That's Klein-Levin syndrome. And it's a extremely rare condition, 1 in a million, literally 1 in a million, where patients will have recurrent episodes of hypersomnolence, okay, so they'll be extremely sleepy, along with hyperphagia, which means that they're constantly eating, and hypersexuality, okay? There really is not any randomized controlled trials to say that this medication is used in these situations, although we do use wake-promoting agents in those cases. And it's actually been shown that something like lithium can prescribed by a psychiatrist, can actually help prevent it. Okay, but the data is not great. There's not a lot of data on this condition because it is so rare. All right, so I remember one of my mentors said, if you may go your whole career and not see a case of Klein-Levin syndrome, which up to this point has been true. So I'm sorry, check me out, but it's so rare. But I would say though, there are resources though. The Hypersomnia Foundation, there are resources of people trying to, rare diseases, that sort of thing, trying to get funding and a better kind of what's what I'm looking for. More understanding of what the condition is and a higher profile, so people will hopefully figure this out down the road. Check Me Out also writes, as a patient for 13 years and currently in the episode, I think research is going the wrong direction. They're treating patients for symptoms, not the cause. I agree with that. But unfortunately, that's kind of the state of the art in many situations. They treat for EDS, which is excessive daytime sleepiness. You're right. Cognitive mood swings, but none of them address the cause, which is not wakefulness. But waking up refreshed and rejuvenated, it is the issue when we sleep and how the neurotransmitters work in the brain and set your body and brain. Perfect. This is not happening in KLS. Please address this. Yeah, I actually wrote back to Check Me Out. I said, agree. There are a lot of issues in the field of sleep and neurology specifically, which still need to be uncovered. I would say KLS for sure. But, on a more kind of common situation, just fatigue, right? Fatigue in general, right? We understand, I think one of my previous videos said that. We understand sleepiness for the most part. KLS is its own thing, but we understand what causes sleepiness pretty well. And, for something like sleep apnea, okay, boom, we take care of that, that should improve. But something like fatigue, there's so many potential causes, we may not even know, right? What is the root of it? And this whole notion of neuroinflammation, neuroimmunology is what we call it, where the brain's or the body's system against fighting off infections and other things essentially is attacking the brain itself, or the consequences of that are making the brain not work as well. That is something which I believe will be much more prominent in the future. Okay, so keep an eye out for that. Yeah, and I said that there's a lot of issues in the field of sleep neurology which still need to be uncovered. KLS for sure, chronic fatigue syndrome, as I just said. Thanks for the suggestion. I will definitely make a video about this. So maybe what I'll do, not with this video, but I may do like maybe a series of videos of undiscovered or unknown or less well-known situations in the field of sleep. Maybe I'll do that. Okay, so keep an eye out for that. Thank you again for this suggestion. Yeah, but for Klein-Levin, there's not really any experts out there for that. It's really just sleep specialists. I would say sleep neurologists know it best, but nobody really knows it well, if that makes sense. Okay. Next, Theo writes, let's talk about medications, trazodone again. He writes, doesn't work that great for me, plus plus brain fogginess the next day. When you become a senior citizen, that fogginess can be frightening. Yeah, that's an unfortunate common side effect of this medication is how you feel the next day, right? So in one of the previous question and answers I've done, it's, people can feel that way afterwards. They can feel drowsy, they can feel tired. I've heard people say they feel dizzy. Those tend to improve with time, but it's not for everybody, right? And the thing to remember though about trazodone, it's not really in that category of medicines which will affect memory, like Ambien and things of that nature. So yes, it's not perfect, but it's sometimes better than those in terms of long-term cognitive issues. Okay. Phil writes to my non-REM sleep video. He writes, this was very informative. My wife can relate to this topic. She does have weird dreams every night. Yeah, thank you, Phil. Dreams themselves, if they're weird, that's not really something we would necessarily go after. If somebody has chronic nightmares, though, right, frequent nightmares, that could uncover, underlying anxiety, underlying depression. Somebody could have something like sleep apnea that could be triggering those nightmares. So if it's just weird dreams and she's not bothered by it, I would just kind of, maybe try a little bit of meditation before bed, try to get her mind into a more relaxed state. That might help. Okay. In my scheduled naps video, Jennifer writes, I don't currently have a diagnosis, but I'm a champion sleeper. A nap would last 4 hours for me, although I wouldn't pass one up. Thanks for the info. Thank you, Jennifer. I would say, if you're a great sleeper at night and also taking a 4-hour nap in the daytime, that probably is your body telling you something's wrong. I would consider you might be somebody who has a hypersomnia condition like idiopathic hypersomnia or maybe even narcolepsy. Now, if you're able to live that way, 8 hours a night and then a 4-hour nap, and you're not bothered by it necessarily, I mean, that's good, but most people cannot live and have that kind of situation. So I would consider looking into that, all right, because there may be something under the surface that you're missing. Not something dangerous necessarily, but something that could be treated with stimulant medications, or at least just having a better understanding about it. All right, so I would look into that. Okay, she writes on my REM sleep video, she says, with narcolepsy, a person will immediately enter into REM. What about idiopathic hypersomnia? Great question. So, no. And that's really what separates idiopathic hypersomnia from narcolepsy, is that narcolepsy is a disorder of REM sleep. So patients are going into that too fast. Idiopathic hypersomnia doesn't have that problem. These patients, the sleep architecture itself is fine. It means that the amount of sleep stages that they're getting is usually normal. The problem, though, is that they get so much sleep, right? So they need 12 hours plus a nap. A 1, 2, 3, 4 hour nap in the daytime. Jennifer, that may be what's going on with you. Okay, so I would definitely look into that. All right. Thank you for that comment. For middle of the night insomnia, my middle of the night insomnia video, Dave writes, "This keeps happening to me. Have yet to find a cure." Yeah, Dave, I don't know what you've been through or what specialists you've seen, but certainly if somebody came to me and had middle of the night awakening, what I always say is there's got to be a cause for it, right? So it's either something physical, meaning that somebody has chronic pain, or they're having sleep apnea, or they're kicking their legs, or it's non-physical, which means that they may have depression. Depression is classic for middle of the night or early morning awakening. All right, so if those things have not been explored yet, I would do it. The answer does not lie in just, here, take some medication and goodbye. You may have to advocate for yourself to get a little bit more thorough investigation, if it hasn't already been done. Okay? Junkyard28 to the same video writes, doesn't sleep medication ruin REM sleep and contribute to memory loss? Excellent question. Some do, some don't. All right? Trazodone, which I talk very, very much about on this channel, is not known to cause memory disorders. It may reduce REM sleep. You're right, most sleep medications do. But if it's a situation where somebody is not sleeping at all, or they're being sleep deprived, versus taking this medication and maybe having their REM reduced a little bit. From a scientist and from a doctor and from a patient perspective, the latter is much more preferable, okay? Because there are consequences when somebody does not get enough sleep at nighttime, all right? So if they're able to now sleep and feel rested and maybe their REM amount is a little bit reduced, that's kind of risk-reward ratio, all right? So good question, good point. Not all of them, not all, most sleep medications do that. They do that to some degree, either REM sleep or that non-REM stage 3, that delta wave sleep. But it's the cost, if you will, of getting a better night's rest in general. Okay? And then on scheduled naps, Brendan writes, "Thanks, Doc." Thank you, Brendan. And with that is the last question or comment. So, and that brings this 3-part video series to an end of question answered from August. So thank you for everybody who contributed. Thank you for everybody who had questions. Keep them coming. I will do videos like this every month. Okay? Just to reiterate, there are conditions out there that we just don't know a lot about. Klein-Levin syndrome, anything in the neuroimmunology world, like I said before, and chronic fatigue, that sort of thing. So the science is moving ahead, and the best thing somebody can do is definitely get checked out, but also be an advocate for yourself. Okay, there are foundations out there. You can talk to your local representative, try to get funding. Okay, so that's the end of this video. Thank you for watching. Please click like. Please subscribe to the channel, and until next time, sleep well.